Hello everyone, and thank you for taking the time to join me for this presentation. My name is Dr. Upasana Mukherjee and I am a postdoctoral researcher at the Reddy Lab. My work focuses on understanding how sleep deprivation impacts the elderly and how it contributes to various health concerns, including cognitive decline. Given the importance of sleep for brain health, today's topic is something I'm passionate about. The title of today's presentation is Sleep Problems in Dementia Patients. Sleep problems are really common in people with dementia and they can be tough for both the patients and their caregivers. You might notice changes in sleep patterns like people being up all night and then napping during the day, or having trouble falling and staying asleep. Some might even wander around at night, which can be dangerous. It is not just about feeling tired. It can make their memory and thinking even worse. And for caregivers, it can lead to burnout. Understanding these sleep issues is key to helping manage dementia better and improving the quality of life for everyone involved. Now that we have introduced today's topic, let's start by understanding why sleep is so important in dementia patients. Sleep plays a crucial role in brain health, allowing the brain to rest, repair, and process information. For those with dementia, this becomes even more critical. Poor sleep not only worsens cognitive function but can also speed up the progression of the disease. Imagine how you feel after a sleepless night: foggy, irritable, maybe even forgetful. Now multiply that feeling over days, weeks, or months and imagine it in someone already struggling with memory and thinking. Research has shown that sleep deprivation in dementia patients can increase confusion and agitation, often leading to a condition known as sundowning, where symptoms get worse in the late afternoon and evening. Studies show that disrupted sleep in dementia patients is linked to faster cognitive decline. For example, studies have found that dementia patients who had sleep disturbances experienced a more rapid progression of memory loss compared to those with better sleep. Proper sleep allows for the clearing of waste products in the brain, including beta amyloids, which is associated with Alzheimer's disease. So, when we talk about sleep in dementia patients, we are not just discussing getting enough rest. We are talking about a critical component of managing the disease. Improving sleep can reduce confusion, enhance mood, and even slow down disease progression, ultimately improving the quality of life for both patients and their caregivers. Now let's look at the specific sleep problems we'll be discussing today, which are common in dementia patients. The four main issues we will focus on are insomnia, sleep apnea, sundowning, and restless leg syndrome. First, insomnia. This includes difficulty falling asleep or staying asleep, a common challenge in dementia. Next, sleep apnea, which is a condition where breathing repeatedly stops during sleep, which can worsen cognitive issues. We'll also talk about sundowning, where confusion and agitation increase in the evening, leading to restless nights. Finally, we'll cover restless leg syndrome, an uncomfortable urge to move the legs that can severely disrupt sleep. Now let's explore each of these in more detail as we continue. Insomnia is one of the most common sleep problems seen in dementia patients. Insomnia is characterized by difficulty falling asleep, staying asleep, or waking up too early and not being able to go back to sleep. In dementia patients, these sleep issues are even more pronounced because of the changes happening in the brain. While anyone can experience insomnia, it is particularly common in older adults and even more so in those with dementia. In fact, studies show that up to 50% of people with Alzheimer's diseases experience significant sleep disturbances. The problem is not just the patient staying awake at night. It often leads to daytime sleepiness, irritability, and further cognitive decline. So why does this happen? In dementia, the brain's control over sleep-wake cycles can become disrupted. Parts of the brain responsible for regulating these cycles are damaged by the disease, which can cause an imbalance in the production of melatonin, the hormone that regulates sleep. Additionally, anxiety, depression, or physical discomfort, often experienced by dementia patients, can make it even harder for them to relax and fall asleep. Managing insomnia in dementia patients is challenging but not impossible. A structured routine can make a huge difference. Encouraging patients to have a consistent bedtime and wake-up time, avoiding naps during the day, and engaging in physical activity can improve sleep. Limiting caffeine, alcohol, and large meals before bed can also help. Creating a calm, dark, and comfortable sleep environment can also help reduce nighttime wakefulness. Simple things like ensuring the room is quiet, using blackout curtains, and keeping the temperature comfortable can promote better sleep. Next, let's talk about sleep apnea, another significant issue in dementia patients. Sleep apnea is a condition where breathing repeatedly stops and starts during sleep. These pauses in breathing, called apneas, can last from a few seconds to a minute or more, disrupting sleep and reducing oxygen levels in the body. This condition is especially concerning for dementia patients because it can accelerate cognitive decline. Sleep apnea is common in older adults, and studies suggest that up to 50% of people with Alzheimer's disease or other forms of dementia may also have sleep apnea. While sleep apnea can affect anyone, it is more prevalent in people who are overweight, have larger neck sizes, or suffer from certain chronic conditions like heart diseases or diabetes. In dementia patients, these risk factors along with the changes in brain function can make sleep apnea even more dangerous. Sleep apnea occurs when the muscles in the throat relax too much during sleep, blocking the airway. In obstructive sleep apnea, this blockage causes breathing to stop and start repeatedly throughout the night. These disruptions prevent patients from reaching deep, restorative stages of sleep, leaving them feeling tired and cognitively impaired during the day. In dementia patients, this is particularly damaging because poor sleep can worsen memory, thinking, and overall brain function. There are several ways to manage sleep apnea. The most common treatment is the use of a CPAP machine, which keeps the airway open by delivering a steady stream of air through a mask worn during sleep. While some dementia patients may struggle to adjust to wearing the mask, many find relief once they get used to it. Encouraging consistent use of the CPAP device is key to managing the condition. In addition to CPAP, other interventions include lifestyle changes like losing weight, sleeping on one side instead of the back, and avoiding sedatives or alcohol before bed, which can relax the throat muscles even more. For some patients, surgery may be an option to remove tissue blocking the airway, though this is generally considered a last resort. Oral appliances that reposition the jaw to keep the airway open can also be helpful for some individuals, especially if they find the CPAP difficult to tolerate. Managing sleep apnea in dementia patients is crucial because treating it can lead to better sleep quality, improved oxygen flow to the brain, and slower cognitive decline. Addressing sleep apnea not only helps patients feel more rested but also supports their overall brain health. Now let's dive into sundowning, a unique and challenging sleep-related issue that's often seen in dementia patients. Sundowning refers to increased confusion, agitation, anxiety, and even aggression that typically begins in the late afternoon or early evening, hence the name. This restlessness can lead to difficulty settling down at night, disrupting both the patient's sleep and their caregivers. Sundowning is common in individuals with Alzheimer's disease and other forms of dementia, especially in the mid to late stages of the disease. Studies suggest that about 20% of dementia patients experience sundowning symptoms. It can be especially distressing for caregivers who are often left to manage a patient's growing agitation during the evening when they themselves are already fatigued. While the exact cause of sundowning isn't fully understood, it is believed that disruptions in the brain's circadian rhythm, the body's internal clock, plays a major role. The parts of the brain responsible for regulating the sleep-wake cycle are often damaged in dementia patients, leading to confusion about the time of day. Reduced light in the evening may trigger anxiety or fear, while fatigue from a long day can amplify irritability. Hunger, thirst, or unrecognized pain may also contribute to increased agitation as the day progresses. Managing sundowning requires a combination of environmental and behavioral strategies. One of the most effective approaches is to create a structured daily routine. Keeping patients engaged in activities during the day, especially physical activities, can help reduce evening restlessness. Light therapy has shown promise in helping to regulate the circadian rhythm. Exposing patients to bright natural light during the day and keeping the house well lit in the evening can reduce confusion about time and ease anxiety. Calming activities in the evening, like listening to soft music, reading, or doing simple familiar tasks, can also help. Some patients benefit from a small snack or a warm drink before bed, which provides comfort and helps them wind down. In more severe cases, medications such as low doses of melatonin or anti-anxiety medication might be prescribed, but these should be used cautiously as they have side effects like increased confusion or risk of falls. Sundowning is one of the more frustrating aspects of dementia care, but with patience, environmental adjustments, and careful management, the intensity of symptoms can be reduced, helping both patients and caregivers get better sleep at night. Lastly, let's talk about restless legs syndrome or RLS, another common issue in dementia patients that can severely impact sleep. RLS is a condition that causes an uncontrollable urge to move the legs, usually due to uncomfortable sensations like tingling, crawling, or itching. These symptoms are often worse in the evening or at night, making it difficult for patients to fall or stay asleep. RLS can affect anyone, but it is more common in older adults and dementia patients. Studies suggest that up to 10 to 35% of older adults may experience RLS, and this percentage tends to be higher in those with neurodegenerative conditions like Alzheimer's disease. Unfortunately, in patients with dementia, it is sometimes difficult for them to communicate what they're feeling, which can make RLS harder to diagnose. The exact cause of RLS isn't fully understood, but it is believed to involve a dysfunction in the brain dopamine system, which helps control muscle movement. In dementia patients where brain function is already compromised, this disruption can be even more pronounced. RLS may also be linked to iron deficiency or poor circulation, which are common in older adults. For dementia patients, these uncomfortable sensations in their legs can cause significant distress. There are several ways to manage RLS in dementia patients. One of the simplest strategies is to encourage regular physical activity during the day. Walking or stretching can help reduce symptoms of RLS at night. Some caregivers find that a brief evening walk helps their loved ones settle down before bedtime. Warm baths, leg massages, or heating pads applied to the legs before bed can also soothe discomfort and make it easier for patients to relax. In some cases, compression socks have been helpful in improving circulation and reducing RLS symptoms. Finally, creating a calm and relaxing bedtime routine is key. Although RLS can be challenging to manage, with the right combination of lifestyle adjustments, comfort measures, and when needed, medical treatment, it is possible to reduce symptoms and help dementia patients get better sleep. In conclusion, today we explored the critical role of sleep in dementia patients and the specific sleep problems they often face, including insomnia, sleep apnea, sundowning, and restless legs syndrome. We discussed how these issues not only disrupt sleep but can also worsen cognitive function and overall well-being. To summarize, we learned that insomnia can stem from anxiety and discomfort, while sleep apnea involves breathing interruptions that can lead to serious cognitive decline. Sundowning creates increased confusion and agitation in the evenings, and RLS presents uncomfortable sensations that can make it hard to relax at night. Addressing these sleep challenges through structured routine, environmental adjustments, and medical interventions can significantly improve the quality of life for both dementia patients and their caregivers. Thank you for listening to this presentation. If you found this information helpful, please consider sharing it with your friends and families who might benefit from understanding these important issues. Your support in spreading awareness can make a difference. If you have any questions or would like to know more about our research and community outreach, please feel free to reach out at reddylab@ttuhsc.edu.